I'm Dr. Herne. I'm a physician employed at Sanctuary Medical Center in Boca Raton, Florida. I'm a board-certified dermatologist. I am also fellowship trained in Mohs surgery. I perform general dermatology, cosmetic and laser procedures, and skin cancer removal, including the Mohs technique. IPL is a device we employ for photorejuvenation of the face and body. Intense pulse light, otherwise known as broadband light or BBL, is commonly employed to treat pigmented and vascular lesions. The device emits a broad range of wavelengths to treat various imperfections of the skin, primarily pigmented lesions and vascular lesions such as age spots, lentigines, freckles, redness, the flushing of rosacea, broken capillaries, and sometimes even acne. This patient seeks treatment for mild redness of the face as well as some light brown spots that she's beginning to see, particularly on her cheeks and forehead. We start the procedure by placing a cool gel over the patient's face. Anyone with sun damage is a potential candidate for this procedure. However, olive and darker skin types may require more caution. Patients often describe the procedure as feeling like a rubber band snapping across the skin. I inform the patients that even though they do have protective eyewear, they will still perceive a very bright flashing light. Typically we see mild redness, tiny bit of swelling, and typically darkening of the pigmented lesions of the face after the procedure. Part of the reason patients enjoy this procedure so much, again, is because there is minimal discomfort, but the downtime is minimal to none. Patients can come in during lunchtime, typically are able to return to work almost immediately. IPL can be used off the face as well. We have treated necks, chests, hands, and arms with this device very successfully, typically to lighten pigment. There is a degree of caution that must be used off the face, and again, you should check with the training of your provider or the operator of the machine. The shape of the handpiece, as you notice, is rectangular. We do have a smaller square piece that is useful for areas such as around the nose and over the nose. With multiple filters and a wide set of parameters, we're able to customize treatments and tailor it to the patient's particular skin type. It's important, even though this is a straightforward procedure, that you do investigate your operator's training. Typically what we see after the procedure is slight swelling and mild redness. This is typically gone within several hours, so the patient again is able to return to work quite quickly. Depending on how many freckles or sunspots are present, there is some darkening of these areas, which forms a very superficial scab, which is typically sloughed in about 3 to 4 days. Kimberly can be expected to return to work in an hour or two, and she will be back for her next treatment in 3 to 4 weeks.